back. It is 9:30 now. Sports and extracurricular activities are back in full swing with students across our city. As many as 3.8 million concussions, though, occur each year across the country, and almost half go undetected and untreated.
Joining us to talk more about concussions, the signs and symptoms, and when you should seek treatment is Dr. Guy Nicolette. He's a sports medicine physician for UT Health San Antonio and the San Antonio Spurs. Good morning, Dr. Nicolette. Thanks for joining us.
Hi, good morning. Thanks for having me.
Well, first of all, what is the concussion exactly, and what are some of the symptoms there?
Well, the definition certainly is evolving, just like our treatment plans. A group of international experts gets together every few years and tries to update everybody on the science and even the definition. And so the current definition is that it's a traumatic brain injury caused by a direct blow to the head or body, resulting in a force being transmitted to the brain, and that force causes this cascade of neurochemical and metabolic and blood flow change that affects the brain. And these symptoms can be different for everybody. There are some classic symptoms, but every concussion can be different, even in the same person for the second or third time. So we really have a spectrum of a definition for concussion.
I think that's a key point that you said, that every concussion can be different because there's different time lengths for one. So how long does a concussion actually last, and when should you seek medical treatment for them?
Yeah, great question. The majority of the sport-related concussion lasts 7 to 14 days. The vast majority resolve within 3 weeks. So it's unusual for symptoms to last that long, but when they do, those usually need more thorough investigation. And I guess I'll point out now that there's really no blood test or imaging that's routinely available that helps that just return to play decision. So it really is a clinical decision at this point, meaning that we go on symptoms and how the patient looks.
Now, you were talking about changes earlier, like the changes in the actual definition of concussion, but what has changed regarding treatment for concussions?
Oh, the assessment and management really has changed over the past 25 years. I was trained at a time when we did, at least for the athletes, and most what we're talking about, happens in football. This is football season, and so it's concussion season. But I was trained at a time when we did a quick sideline assessment, and as long as the athlete was grossly normal and felt comfortable going back in, we would let them play in 20 minutes, and that was completely standard of care. It was even published as these Colorado guidelines back in the day.
Now,
and so things have really changed. We would never let, in today's world, that athlete that had a concussion go back into that same contest.
I think that was seen on the national stage, with the Miami Dolphins quarterback Tua Tagovailoa. That's been a big conversation because, again, multiple seasons he's been experiencing some type of medical situation on the field. Has a lot of people asking this question: if you have had a concussion, how likely are you to have another one?
Well, I mean, the scientific answer really is pretty vague. It's more likely, but we really don't know exactly how much more likely. There seems to be a little bit of a compounding effect, and while I think it's logical and probably just common sense to say that more concussions are worse than no concussions, it's just been hard to prove how many is too many. And the first concussion, it's easier to get the second concussion than the first, and easier to get the third than the second, and so on and so on. But we can't yet quantify that, and so it's just highly variable. And of course, the severity of each concussion can help somebody determine whether or not too many is too many, and how likely the next one is really going to be.
All right.
I think there's a lot of clinicians and scientists interested in that question. So I'd say, check back in a few years, because we really are devoting a lot of research and time to study the effect of multiple concussions and help people make more informed decisions.
All right. Well, thank you, Dr. Nicolette. That's important information for, all our athletes, trainers, and coaches especially. So for more information, you can head over to uthealthcare.org/sportsmedicine. Again, thank you, Dr. Nicolette.
Thanks again for having me.